Hi guys, tonight we'll be discussing the issue of the criminal status or the legal status of drug users. So we propose that the United States should decriminalize the use of illegal drugs in favor of a treatment and rehabilitation-based approach for end users. This isn't a proposal to change the legal status of controlled substances, but a proposal to end the treatment of illegal drug use as a criminal matter and instead begin its treatment as a public health issue. So it's, I think it's fairly apparent to everyone that drug use presents some significant problems to our society. First of all, it's very costly. And it was estimated in 2007 by the National Drug Intelligence Center that drug use costs us about $193 billion. So when it comes to preventing these problems, I think policy decisions are fairly important. So anyway, just to give you guys an outline, I have several points to make. One, that drug abuse is very costly to the American public and that prisons are overcrowded and a significant portion of their population is drug offenders. That the current drug criminalization scheme does not effectively reduce the negative impact of drug use on society. In fact, criminalization of drug users disproportionately impacts vulnerable communities, and criminalizing drug users prevents them from integrating into society in a healthy way. So that first point, the current drug criminalization regime is not at all effective at reducing the impacts of drugs on society. In 1971, 2 years before the creation of the DEA, the CDC reported that slightly more than 1 death per 100,000 people in the United States was related to drug overdose. By 2008, there were 12 overdose deaths per 100,000 people. That's a 12-fold increase from the time that the DEA was created. Another point is, or in the words of Alex Crete, a professor at Thomas Jefferson School of Law and an expert on illegal drug law, for all the money we spend, there is little evidence that our current drug strategy has significantly affected drug use rates or availability. Another study found that increased drug enforcement is actually positively and significantly associated with increases in violent crime. So, in addition to the fact that it's generally ineffective, criminalization of drug users also disproportionately impacts vulnerable communities. A study by the Cato Institute found that blacks and Hispanics are much more likely than their white counterparts to be arrested for drug crimes and raided by police, even though those groups use and sell drugs at similar rates. Another statistic, again from the Cato Institute, says that black individuals make up only 10% of the U.S. population as a whole, but they represent 62% of the drug offenders sent to state prisons. And not only is this ineffective at reducing these problems, but in a way, criminalization can prolong the issues associated with drug use. A felony drug charge, which in some states requires only 3/4 of an ounce of marijuana, can cause an individual to lose eligibility to work for the federal government, enlist in the U.S. Armed Forces, obtain an import, customs, or other license, or obtain a passport. According to Newswise, it's estimated that about half of all people who are incarcerated are there, at least in part, due to an active drug or alcohol problem, but only 10% of them receive the drug rehabilitation they need. When released, they often immediately return to active drug abuse within days, weeks, or months. So, in contrast to this criminalization scheme, we propose that drug users should not be treated under the law as a criminal, but rather the most serious cases should have resources directed to them. And the treatment-based approach will allow more effective focusing of these resources. According to Mark A. Kleinman, a small group of hardcore drug users, which accounts for about 80% of total consumption, creates a set of problems out of proportion to their numbers. So by focusing treatment on those who need it the most and essentially ignoring those who use drugs in a non-problematic way, the resources could be better spent to reduce the problems that drugs present as a whole. According to the California Department of Alcohol and Drug Programs, evaluated as a crime control measure, providing drug treatment for criminally active addicts is strikingly cost effective, reducing criminal activity by about 2/3 at about 10% the cost of a prison cell. In addition to the effectiveness, problem drug users are more likely to have success in the future when given treatment as opposed to prison. Maryland's Alcohol and Drug Abuse Administration reports that people discharged from the programs they fund, which are treatment programs, had substantially lower substance use than they did at admission. They also report lower arrest rates and the commission of fewer crimes. A similar program, Brooklyn's Drug Treatment Alternative to Prison, allows drug-addicted defendants to enter a 15 to 24-month residential therapeutic community treatment. More than half of these participants completed the program and showed arrest rates that were 26% lower 2 years after leaving the program, and they are 67% less likely to return to prison. Thank you.